Hi, everyone. Understanding where to start when it comes to your VA healthcare benefits can be confusing and very daunting. So, today we're going to discuss what your VA health benefits entails and how you can access them. My name is Maria Hamill, and I am the Learning Programs Coordinator here at Veterans Upward Bound. If you have any questions, concerns, or want to talk about workshops, please feel free to email me. I have my email here on the screen. So today we're going to go over what will the VA healthcare cover, who will provide my care, and then how to apply for VA healthcare. So this information that I'm going to present today is all in accordance with the va.gov website, and I will provide the link at the end of this presentation that you can look more in depth into the topics we'll be discussing, and they have way more information than I'm able to go over today that you can take a look at. So first of all, what care and services does the VA healthcare cover? Each veteran medical benefit package is different, but all VA healthcare includes care and services to help with treating illnesses and injuries, prevent future health problems, improve your ability to function, and enhance your quality of life. In addition, the basic healthcare services through the VA cover preventative care services such as health exams, like or yearly physical, health education such as nutrition education, immunization against infectious diseases like flu shots, and counseling on genetic diseases that run in the family such as autism or cancer. They also provide inpatient hospital services such as surgeries, medical treatments, kidney dialysis, acute care for short-term illnesses or injuries after surgery, and in addition, specialized care such as organ transplants, intensive care for mental and physical conditions, and care for traumatic injuries. So they have different locations that you can attend to get care, but it's covered urgent and emergency services through different VA health facilities. But they also are covered you're covered if you're able to go to an urgent care location that is part of their contracted network. And it'll be included in a VA approved walk in retail clinic, such as like an urgent care. And these kind of urgent cares are for illnesses and injuries that need attention right away but are not life threatening. Some other services and needs that are covered under the VA healthcare are mental health services for PTSD, military sexual trauma, depression, and substance abuse problems. Assisted living and home health care is also covered, and prescriptions written or approved by a VA doctor. What other medical services will VA cover to support my treatment? Services that the VA primary care provider concludes that you need to support your treatment, such as tests used to diagnose health conditions like blood work, x-rays, and ultrasounds, therapy and rehab services, such as physical therapy, vision rehab, and therapy for traumatic brain injuries or TBIs. And they'll also cover prosthetic items, audiology for hearing loss, and radiation oncology for cancer care. So these are the different services that your primary care provider suggests that you will need to be able to support the treatment. All right, so after you sign up for your VA healthcare, you might be wondering who will provide the care for me at the VA. So once you sign up and you're approved and you choose a main veteran location or VA location that's close to your home, likely, the VA will assign you a patient-aligned care team, or otherwise known as PACT. And this team is made up of you and other healthcare professionals that will support you in your healthcare journey. And they include your primary care provider. So this is like your main doctor. I like to think of it kind of as a family doctor. Your clinical pharmacist, so this is someone who will work with your primary care provider and making sure that you're taking appropriate medications for you and your overall health. You will be assigned a registered nurse care manager, and this person is just making sure that the care is being coordinated across your primary care provider and other individuals who you may need to help you in your health plan. And lastly, you will be assigned a licensed practical nurse or a medical assistant, and this person's just making sure that everything is going smoothly and everyone is there to support you to meet your needs. So we touched on this briefly with what's covered underneath VA healthcare, but we'll go a little bit more in depth on where to actually go for your care. So there are 5 different options for getting care. The first one is visiting VA medical centers. And VA medical centers offer a wide range of services. They provide traditional hospital-based services like surgery, critical care, mental health, and physical therapy. And some centers also provide specialty surgical and medical services like oncology, which is cancer care, geriatrics, which is elder care, plastic surgery, neurology. So it just depends on the location that you're going to, but they can range from specialty services, but they will have just regular hospital-based services as well. Can also go to a VA community-based outpatient clinic to receive care. And these clinics are providing common outpatient services like health and wellness visits. I like to think of that as going to a like doctor's office to get like a physical. So there is a VA community-based outpatient clinics within your area as well. Can also go to VA centers. These centers provide community-based counseling, outreach, and referral services for veterans and their families. They also will have mobile vet centers that can bring care to more rural locations. So these vet centers are mostly based to help refer you to care or with outreach. The VA also has VA community living centers and other assisted living residential settings. So these places provide support for veterans who need more intensive care to help with everyday tasks like bathing, dressing, or taking medications. And lastly, you can receive care at your own home. So if you need medical treatment or help with everyday tasks, there is an opportunity for folks to come into your home and to help you with that. Common question when it comes to the VA benefits are, will the VA cover my vision and dental care? Vision is covered. They have routine eye exams and preventive tests for your vision. In some cases, there is coverage for eyeglasses or services for the blind or low vision rehabilitation. When it comes to dental, it's a little bit different. In some cases, you may receive dental care as part of your VA health benefits. However, it's kind of on a case-by-case basis, so you'll want to check when you are going to apply if that's something that you're eligible for. So you're probably thinking, all right, what does this all cost to me? So the VA will provide free health care for illnesses or injuries that the VA determines is related to your military service or service connected. So they need to be, any illnesses, injury need to be connected with your time in the military. However, they do have free services for anyone who has the VA healthcare for readjustment counseling and related mental health services, care for issues related to military sexual trauma, and a registry health exam to help determine if you're at risk for health problems linked to your military service. You may also qualify for free VA healthcare depending on your income, disability rating, or other specialty eligibility factors. I will make sure that I have this link attached in the email of this workshop so you can take a look at your eligibility and the care costs when it comes to the VA healthcare because it's a lot more information than I'm able to go over today. Here's a snippet of your eligibility to receive healthcare benefits. There's a lot of information. Again, I'll make sure this link is attached in the email of this workshop. Feel free to pause this video really quick to take a look at the eligibility requirements, and there are additional information on the website, but I'm not going to go over each individual eligibility requirement here today. If you need help to assess any services or help with applying for VA healthcare benefits, feel free to call the VA at their number here on the screen. And you can also contact your state's veteran agency locally to ask any questions about eligibility, care costs, and any questions that you may have. So I want to show you how to apply for VA medical benefits. It's a pretty smooth process from what I understand, and you can apply all online through the va.gov website. So you will first sign in to make an account. I do not have one, but you will click on this button here on the screen to sign in and make a account so that you can fill out all the information that you need to apply. And before you get started, I would take a look at these steps here, and they are in regards to checking your eligibility. So you can see that there's some eligibility requirements. We briefly went over them in the presentation a few moments ago, but there are more information here that I'm not able to go over that you can take a look at to make sure that you are indeed eligible. You'll want to make sure that you gather your information before you apply, and this includes your social security numbers, your military discharge information, any insurance cards that you have for healthcare companies that cover you already, such as Medicare, private insurance, insurance from your employer, etc. You will need last year's gross household income for you, your spouse's independents, and deductible expenses for the last year. Then you are able to start your application, and you could either click on the button at the top of the screen here or this button here, that's this blue button, to start the application. I want to note that it takes people roughly about 30 minutes to complete this application. And again, if you need any help with any of the questions that they're asking through the application, your eligibility, care costs, anything that you need help with that you just want some additional information on, feel free to give the VA a call or go to a local veteran office to ask some questions. And that information is right here on the screen. Thank you. I hope that this information on VA medical benefits was helpful. If you have any questions or concerns or want to talk to us about workshops, please feel free to reach out to us through our email, our website, or our phone number. Thank you and have a good day.